Do you think life is simpler as time evolves? For some, it can be more complicated when facing issues about health, estate plans, probate, long-term care, and more. That's why Attorney-CPA Joe Cordell hosts ElderTalk with TuckerAllen, providing intelligent answers for those thinking about their future. Here's Attorney-CPA Joe Cordell.
Welcome to another episode of ElderTalk. And you know, we can't simply, Jill, get away from talking about the pandemic and its effect on our families, our community, our daily lives. So we're continuing this discussion, especially because we're seeing numbers ratchet up and people talk about, kind of the double dip. This may very well be something that actually escalates to a greater extent than what we saw in the spring.
Yeah. In fact, my kids, I just found out, the Board of Education at their school district voted unanimously to send them back online for the rest of the semester. There's just been a number of cases within their school, within their high school, and they were having to quarantine too many people, and it was getting difficult to fill the classrooms with teachers and finding substitute teachers.
Yeah, and I worry that, the last thing the economy needs is another lockdown.
Oh, yes, that would be horrible.
These poor restaurant owners and people who are in the travel industry and so many businesses. So, related to this topic, we figure we should have somebody on who can talk specifically about how this and other health concerns are affecting seniors during this holiday season. The holiday season is very different from the rest of the year. And I want to make this point before we launch into this as a platform, I think, for this discussion. Many people don't realize that your probability as an older person of suffering an event, a health event, is dramatically greater, believe it or not, between the period of 2 days before Thanksgiving, or say the day before Thanksgiving when many people start traveling, all the way to the end of the year. And there are various studies, but they all are unanimous. There was one that was done of emergency room physicians and asked them, what do you see? When do you see the biggest influx of people and describe, who they are, ages, et cetera. So what happens is during this period of time, people are traveling, so that creates a whole new opportunity for issues. You have events relating to strokes, heart attacks. People are eating more, they're doing more, they're straining more. Some are even out playing touch football, over
They're shopping.
It's just, a lot of stuff going on. And then there's always the possibility of a fall. I mean, slip and falls are huge for people, of course, who are over, say, 70 years old. Those numbers go up during the holidays because, again, people are doing more than they normally do, and there's more hustle and bustle. So there's a bit of a hurry associated with lots of the things they're doing over that period of time. And then, of course, there's stress. And lest I forget, there's a pandemic this year. So that'll mean less travel, but it still doesn't eradicate those other risks. So with that as the sort of platform for this discussion, introduce our guest, Jill.
Yes, one of our favorite guests, Ann Aliben. She's the CEO of Premier Home Health, and that's a veteran-owned Medicare certified skilled home health company. Ann, we're so glad to have you back.
Oh, thank you so much. What a nice introduction. I'm happy to be here.
Well, you're a popular guest. You're back by popular demand. You're at least popular with me and Jill. And
Absolutely.
I'm kidding you, but the point is, whenever you're doing a podcast, and we made this transition, so we would get some feedback when we did radio. Because, people will call the station, they're more likely to reply on social media, et cetera. So we had more familiarity, and we know you were popular from previous appearances. But now we feel like we're a little bit in a vacuum or siloed almost, so that we don't have the sort of direct feedback we would like to see from the people who listen to the show. So we should take a moment here, Jill, and emphasize the importance of people communicating with us, going online. We have a Facebook page.
TuckerAllen.com.
Yes. So we really want to hear from you about things you like, you don't like. Give us thumbs up whenever we post on Facebook, or rather on YouTube. let us know what you think of our videos or what will be videos, and as well as we have Spotify, and we're on virtually
iTunes.
all of the iTunes, all those podcasting stations that you have on your apps. We try to be widely available because we know people use different platforms. So, Ann, we're at the threshold of the holiday season. Do you have people who around this time of year are approaching you with what are their arrangements going to be over the holidays and asking for your advice or assistance associated with those events?
We do. I would say almost every year we try to put on a series of presentations in different senior communities because the holidays can be a very stressful and hard, and in some cases, very lonely time for anyone of any age, but certainly for people who are older and living alone and maybe away from family.
Or lost a
Um,
spouse, maybe.
yes, exactly. I mean, it can be a tough time for people. So, of course, we've all recognized that for probably most of our lives. And this year is unlike any other year that,
Oh,
most of us have seen, unless you're more than 100.
yeah.
Um,
Well, thankfully, you may have that may be some of your well-cared long-term clients, but I guess we can handle this every 100 years. The problem is you don't learn because when something occurs every 100 years, you don't get the experience that survives to deal with it better.
Right.
Familiarize our listeners with the number of facilities that Premier Home Health is involved with.
we we provide skilled nursing and therapy in probably upwards of 10 to 15 different communities, and then to hundreds of patients who live in private homes.
Just individuals. So,
Right.
what you do with communities, is this a contract that you'll have, for example, with a long-term care facility or assisted living facility in which you will come in and perhaps exclusively provide these home or these healthcare services?
So for certain services, yes. For example, if it's something that's going to be paid for by the management of the community, then yes, it would be something that we provide and exclusively provide. Some of the places that we work with right now are paying for things like someone to go through the community and just do a daily screening of every resident,
Mm-hmm.
in terms of taking your temperature and using a pulse ox to see what your oxygen is and going through the daily questions.
Yeah.
When we talk about skilled home health with the nursing and the therapy, since that is paid for by Medicare ultimately, or perhaps one of the Medicare Advantage or private insurance plans, they dictate that the patients can choose who they want, even if they live in a community. So oftentimes we'll be a preferred provider and the
Mm-hmm.
one that's recommended if someone doesn't have a choice, but the patient still can make their own, if they really feel strongly that they want to go with a different company, they can.
So tell me, what are the range of services that Premier Home Health provides?
So we have nursing, and our nurses do things like help with medicines. It's always shocking to people how often taking medications properly can be a challenge for normal people who all of a sudden, were taking one or two medicines for most of their life, but then ended up in the hospital and they've come home with 6 or 7 or more.
Yeah.
Sure, I imagine that can get confusing.
Well, plus, I mean, it also assumes some cognitive decline, right? And
Absolutely. And sometimes there are just some logistical issues. I mean, if, say, for example, your insurance company wants you to use one of the 90-day pharmacies that are by mail order, that sounds great and it saves you money. But for the first month or so, you're probably not going to have those pills. So you need to get them filled somewhere. And the hospital or rehab only sent you home with 5 days supply.
Right.
And
That can be very
sometimes
stressful.
the ordering doctor and the insurance company have a little bit of a back and forth about whether to approve the name brand that's newer or the generic, or not really a generic, but some older version that's been around for a long time that doesn't do as good a job, but is, way cheaper. In our experience, the first 30 to 60 days after coming out of the hospital or a skilled rehab really present a tremendous opportunity for just getting your medicines all messed up. So our nurse will help with that by going in, taking the hospital med list, calling the doctor's office, going over it with them, making sure the scripts are all there, and setting up a pill planner.
So when we look at then the range of services that Premier Home Health provides, we would say nursing care, right, which would be a general sort of skilled care. In other words, a registered nurse or maybe a nurse assistant. Do you also provide those relatively unskilled nursing assistants or
Registered nurses and LPNs, licensed practical nurses.
those are considered skilled care?
Yes.
Yeah. And so what other services?
Physical therapy, which can help with, I think you mentioned people falling earlier,
Mm-hmm.
can help with falls or back pain, or a lot of people start to struggle from just low endurance. One thing that we've seen a tremendous amount of in the last several months is people who just have kind of a general decline because they're not going out. If they used to walk through the mall or go to the grocery store or walk around their neighborhood, they're not doing those things, whether they live in a home or a community. They're just sitting.
And that's not surprising.
No, it's not.
It really
but we've
isn't.
just seen the toll it's taking is really
Yeah.
starting to add up.
Yeah, there's a price that we pay associated with this lockdown that I think many are not willing to acknowledge, and among them is the fact that there's less socialization, there's more isolation, there's a vulnerability to having things that would otherwise have been diagnosed, they're not diagnosed, meaning whether it's some early growing cancer, whether it's some developing disease or whatever it might be. Things tend to get put aside or placed on a shelf. And then simply, as you were suggesting a few moments ago, the activity levels tend to go down with isolation. So, it really is a big price to pay with what older people especially have had to deal with. So you mentioned nursing, you mentioned physical therapy. What other sorts of services do you provide?
Occupational therapy, and they work with things that are generally called activities of daily living, like bathing or getting dressed. You see occupational therapists work with people after a stroke, oftentimes helping them just go through the normal grooming routine of brushing your teeth and fixing your hair, things that are harder as we lose, fine motor skills.
So whenever you say occupational therapy, it's really a misnomer because it doesn't require that someone have an occupation. And as it pertains to older people, it often does refer to the very things you're talking about. So there really needs to be another name for that profession.
You're exactly right.
Yeah.
I mean, it's very, very misleading because, right, I mean, it's things like cooking and making your meals and doing laundry. And it's not so much teaching you how to do those things, but teaching you how you can still accomplish those tasks, even if you say all of a sudden are using a walker, you can't carry your laundry basket.
You have some sort of disability now to where it makes those everyday tasks difficult or more challenging.
Right.
So we have any sort of nursing, RNs, LPNs. We have physical therapy. We have occupational therapy. What other services? Anything else on the list?
What about home health care where they come over and say make meals or run to the
Unskilled.
store? Yeah, unskilled.
So we assist with bathing, but our services are all pretty much skilled
Yeah.
other than that.
Because Medicare only pays for the skilled, right?
Right. We also assist with speech therapy. So speech therapists work with people who have swallowing problems or speech problems, obviously, and then also cognition or memory, and not so much in context of someone who, say, has dementia and has had it for 3 years, but more someone who maybe had a really bad bladder infection or was in the
Yeah.
hospital for 3 or 4 weeks and got pretty confused while they were there. And then they go home and some of that confusion can linger.
Yeah,
Then the speech
I've seen
therapist
that.
can really work
I have
with
too.
them and regain a lot of the cognition that they just somehow lost while they were ill.
And respiratory therapy, I imagine.
Yes, we work with that, trying to build up someone's ability to, well, to go for a longer walk, to keep their oxygen low. We're seeing a lot of people now coming out of the hospital on oxygen, but hoping to wean off of it once they're home and as they get stronger.
What are you hearing from your clients through the pandemic, especially with the holiday season? Are you, seeing more depression and anxiety?
We are. People are really scared, and it kind of presents not in some kind of an overt, I'm really scared about the pandemic sense, but just kind of as an underlying, almost a low level buzz that's always there,
Yeah.
regardless of what you're talking about. So, I mean, people are afraid of getting sick, especially in the last 3 or 4 weeks. We've seen this explosion of COVID cases, and that's kind of trickled into people afraid to go anywhere, the hospital or outpatient therapy or the grocery store.
So then what is the balance between, on the one hand, people needing to stay away from places where they'll be exposed to this virus, among which most notably might be a healthcare facility, an emergency room,
Mm-hmm.
and then on the other hand, the fact that it's important that they not neglect things that need attention. Just because we have a pandemic on, it doesn't change the fact that they need to take care of their health and be proactive, et cetera. I mean, how do you balance those two competing concerns?
Well, I think you're right. I think being proactive is even more important now than normally. I tell everybody our staff has been wearing a surgical mask with a cloth mask, which is kind of a lot, but they've
Two
been wearing
layers?
it since
Wow.
March, and we haven't had any exposures through that.
Do you use the N95 mask? Isn't that what it's called? N95?
N95, yes.
It is, and in the last few weeks, we've started to use it a little more. Back in March, of course, they were impossible to get, and nobody had a stockpile of 90 N95 masks. So that's kind of what led to us coming up with the surgical and a cloth
The
mask.
double
And we
layer.
have found that it's, highly effective in terms of preventing spread of the disease.
So in other
So
words, have you actually been around people where you know that they either had it or they subsequently developed it, where they would have been contagious when you were there, so you can say, gee, we were around them and we didn't get it, or vice versa?
yes. Yeah, we've had that happen probably more than a dozen times. And, of course, everyone worries that they've already contracted it. So the normal routine is we'll find out someone was positive when we saw them, and then in the, right number of days, because that seems to keep changing, the
Yeah.
nurse or the therapist will go
Right.
and get tested. And so far we've had negative results the entire time.
Do you insist, though, that the people you're working with, that they also have masks on? And
Until about a month ago, we were a little more flexible about that. But it almost seems like just as a community, we've all kind of gotten this heightened sense of, oh wow, this disease has finally made it to made the entire Missouri area in force. So as you've seen more cases and people have gotten more ramped up, so have we, and we've started saying to people, you really need to have a mask on when our therapist comes, and they've all said, sure, no
So
problem.
nobody's refused?
No,
You didn't have that one stubborn person?
not yet. I know, not yet. Hopefully no.
What about family gatherings? I guess we can expect that there will be, hopefully, I mean, you want to think that people who are seniors for whom, family is so important and who might not have the opportunity to get together with their families throughout the year, given the fact that we're dispersed as we are across a continent, many of us. So you hate to think that they're not going to spend genuine family time over the holidays. Are these issues coming up with any of your patients?
They are, and like so many other things, it seems to be just a very personal decision. I have had people say to me, you know, I'm in my 70s and my parents are in their 90s, and we've already all decided to quarantine until there's a vaccine. And I've had other people say, well, I'm going to move my mom in with us because we certainly don't want to not be able to see her for the next 6 months, because what's the point of living forever if you can't be around your family?
Right.
Yeah, yeah,
And, the truth is both of those have reasonable support behind them. It comes down to, like I said, kind of a personal commitment.
And, Ann, with the flu season upon us, that just adds, it's an added risk for seniors amid this pandemic. What precautions is Premier taking, not just for their clients, but for their staff? I mean, this is a double whammy.
Oh, it really is. I mean, we're doing basically what we've been doing the entire pandemic. I mean, with the double masks, and I mean, if you need PPE, you should call me because we have we have all of it. We have goggles and face shields and gloves and foot covers and
when you say
gowns,
PPE, what's that?
personal protective equipment
Okay. And
that
how
the
many
hospital,
employees do you have?
right around 40.
And so, in order for people to use your company, they don't necessarily have to do it through Medicare. They can choose to pay out of pocket, I assume.
Yes, we actually had that happen just yesterday. Someone called and wanted to know if they could just hire us to have one of our nurses follow their father. And by follow, I mean come out and see him every week.
Yeah, yeah, I can really see the role of, especially during a time like this when doctors' attention is so hard to get. I mean, it's frustrating that you sense that doctors, for the most part, in most parts of the country, are not that busy dealing with COVID. As a matter of fact, many doctors have no patients with COVID,
Right.
and especially in a variety of specialties. But nonetheless, during this period of time, perhaps in some cases it's attributable to hospital policies. I know WashU had very strict standards before they would allow people to come in. They had to have an urgent need, whatever that definition was. And so there are various barriers to getting in to see doctors now, oddly enough. So it becomes more important to have somebody available to you. And the great thing about a nurse is, as a practical matter, I mean, a good RN, anybody who's worked in a hospital knows this. I worked in a hospital all through undergrad, and I developed a lot of respect for nurses because nurses are functionally as helpful in many situations as a doctor.
Yeah.
And I mean, they, especially if it relates to something that they've dealt with a lot, which, if they work with geriatrics, I mean, you go on a floor and you talk to an experienced geriatric nurse about any of the number of common things that as we age we suffer from. And they've sat and been involved in so many discussions over so many years that their judgment about most things relating to that person is going to be right on, including predicting what will be prescribed, et cetera. So the idea that not only do you have access to somebody who is less expensive and who has more than 10 minutes and who they're also willing to visit your home. When was the last time that happened, that you had a doctor visit your home? So I think that seniors vastly underuse the potential of having nurses that are available through various organizations, and Premier Home Health, of course, is one, where you can pay these nurses to come in. In some cases, Medicare pays for it.
Right.
So, I mean, that's even better. And if Medicare doesn't, some private insurance does. So I encourage our listeners out there that if you have a loved one or you yourself, have some sort of chronic issue such as those we've been discussing.
Take advantage of these services.
Yeah, there is an alternative to having to go
Yeah.
in and make an appointment with a doctor who seems so reluctant to see us. It's really frustrating.
It is. It is. And, Ann, I was wondering, have you lost any clients out of fear of the pandemic, especially with the flu season? Maybe they just don't want anyone coming into their loved one's home because they're afraid they may get infected with the virus. Have you experienced any of that?
So back in March, when this first started, and sometimes I describe that period as, when we were really scared, we had a pretty good chunk of patients say, you know what, I want to take a break and wait a little while and see what happens. And we put them on hold and, didn't go back for a month or so. Currently, we have not seen that. The people that are being referred to home health are what I would call generally sicker, higher acuity needs than at other times. They're difficult, not in, a personality standpoint, but they just require a lot of care. So I think that offsets somewhat their ability to even say, hey, I don't want this because they know that they need it. And of course, we, now we're several months into this and we can reassure them we've been wearing masks and we haven't had anybody get sick and we haven't exposed anyone. And we're a pretty safe bet to come in.
So what are the sort of things that were placed on hold? I guess this would go on that list of stuff that goes unnoticed when people are considering the consequences of lockdowns, et cetera. But when you tell me, and I can imagine that this would be true, that a lot of people, just like they're not going to healthcare facilities in part for fear, in part because of reluctance to be seen, but these people are people who are saying no to home health services. What sort of services did you see put on hold commonly during much of this year?
We saw some physical therapy and we also saw some lab work. So some people would say, we don't want anyone to come in and get our blood and we're not going to go to the lab. We think we're fine. There were other people who would say, well, we're definitely not going to the doctor. But if the doctor wants to have a nurse come out and draw our blood and do, that part of, say, an annual visit, then we'll let you come out and do that, but nothing else.
But they just didn't want to go to a healthcare facility.
Right.
But they had some distrust of your coming into the home, too, for fear of, being exposed to the virus.
Yes, they also would. And then, like I said, there was a whole other group of people that would say, we don't want anyone coming in. Where, we're fine with not getting our labs checked and we're fine with not doing therapy. The other thing that we've really seen, and maybe it's hitting in the last month or so, is it seems like there's a huge delay. For example, if you need surgery and you're elective surgery, but still, fairly important, say a knee replacement, there's a lot of talk about limiting them right now.
Right.
The hospitals are full and home health companies are getting full. So a year ago, if you had a knee replacement and you came out of the hospital, you would come home on, say, a Friday, and on Saturday, you'd have a home health nurse and therapist there. And today, I would say you would come home on a Friday and you would have a home health nurse and therapist there by Monday. So there are all of these little delays that we're seeing, things like that.
And they accumulate, though.
Yes, exactly.
And what seems like such a waste of talent is doctors, especially. Doctors in the United States are the best trained anywhere in the world. I mean, there's no question that.
Oh, hands down.
I mean, the what's demanded of a medical school in the United States is beyond quite frankly, what should be demanded, meaning that they're so exclusive that certainly they could stand to lower the bar a little bit so we could have more doctors. But so here you have all these incredibly talented, world-class experts, and I understand if the message from them and their employers is that, look, they're not available for you because they're attending. We have our sleeves rolled up. We're doing triage, and we have all these COVID cases, and so that's what they're doing, and they're prioritizing people who have this condition. Then I think all of us would say, yeah, that's the way it should be. That makes sense. But instead, what's happening, and a good example are these surgeons who are now or were just doing surgeries that were life-threatening or some similarly high standard. And so you wonder, what are they doing all day when you can't do this? I mean, so you imagine that this incredibly talented surgeons and all these specialists in all these fields, what can they possibly be doing? I assume they're watching YouTube. In reality, we may laugh, but they're not working. Some are doing some telemedicine, but that's fine. We're not complaining about telemedicine. That's great. They're working, and it's getting the job done. But what we're talking about here are people who need sorts of medical care that isn't accomplished through telemedicine. And that means that if the surgeons, for example, are not doing surgery, they're not seeing their patients, right? Because the patients can't come in unless it's life or death. So all these optional surgeries that may have, even surgeries that are not optional, but they're not urgent.
Right.
They wouldn't see. So, you have to realize that this policy results in these incredibly talented people sitting around watching television. And if they're not watching television, it's something of comparable value, meaning they're not working.
Right.
And it seems such a waste of talent.
It does.
And health. What are the implications of the things that go unaddressed, that were maybe misinterpreted in terms of their urgency, or were not diagnosed? It's just an incredible cost associated with these lockdowns that I think simply don't go on the scales when we're measuring one option versus another. And but I think that as long as we have, Ann, a company such as yours available, Premier Home Health. So the good news is that those of you who need this sort of care in your home, you can have these skilled home health providers come in.
And another good thing about having these professionals come into your home, they may be able to spot something that the patient hasn't, and notice, hey, something doesn't seem quite right, and then urge that patient to go get, whatever it is checked out. I think that's really important.
And one of the things that I think this pandemic and all of the rules that have kind of come out and gone away and come back and gone away, and I guess they're maybe coming back again. One of the things that have been highlighted to me from my kind of bird's eye view is the difference between companies and physician groups who are independent versus those that are owned or managed by the hospital systems.
So tell me, what are the differences you see between those two groups? I'm very interested in this, and I think that our listeners know that, many small practices, if you were to look at the landscape in the medical field, say 20, 30 years ago, you would have seen all the way to the horizon, privately owned small practices like law firms, like partnerships, but it was of doctors, and that was the way doctors practiced. And now, probably clearly in excess of 50%, maybe in excess of 70 or 80%, have been acquired by insurance companies, large medical providers like hospital networks, et cetera. So they've become employees of these large institutions, and yet you still have out there this minority of practicing physicians who have still their own practices like it was 1975. Is that a fair characterization, Ann?
It is. And we're very fortunate to work with a group that's independent. And some of the things that really make them stand out, their doctors see their patients in the hospitals. They do hospital rounds at least 2 different hospitals every day, and their staff know their patients and their families, and it provides a continuity. So
Mm-hmm.
in contrast, someone who works for a doctor who works for a hospital rarely goes into the hospital. He works in his doctor's office, or she.
Mm-hmm.
And then if the patient goes to the hospital, then they're cared for by a different doctor who has access to the electronic health records. But the truth is, there's a lot of clicking on different tabs that doesn't always take place, especially at a time like this when everyone's too busy.
Now, what does that mean, what you just said?
So there's a really big benefit to a patient when the doctor that they've been seeing for 10 years is the same doctor who sees them in the hospital,
Mm-hmm. Right.
knows maybe what medicines have worked in the past and what hasn't, and then follows up with them the week after they go home to see how they're doing.
But you mentioned clicking tabs. I thought you were referring to.
Oh, okay. So the contrast to that one person is that because we have electronic health records, the doctor who works in the doctor's office can see everything that's going on in the hospital because they have access to the same system.
Yeah.
Yeah,
Okay.
because through the technology, right.
So
Yeah,
the independent
sorry.
docs are not disadvantaged by not participating as an employee of an institution. But wouldn't you say then that that many of these doctors have continued to see patients? These independent doctors have continued to see patients through most of this crazy year, more so than perhaps their corporate employee counterparts.
It seems like it to me. And not just primary care doctors. I mean, when you look at independent surgeons, they're the ones kind of saying, well, let's do it at the surgery center then.
Yeah.
As opposed to the surgeon who works for the hospital group who's been told, well, we're going to put surgeries on hold. I mean, their hands are tied.
In some insider baseball too, for people who may not know this, is when you're an employee of one of these large corporations, one of these, for example, hospital networks, then you're on a salary. So when the hospital decides to implement this policy that is going to tell patients don't come here unless you have a real good reason, you can afford to be, at least from a financial standpoint, indifferent because you're still getting your paycheck. So whenever you decide to, whenever you want to go to stay at home or whatever you're doing during the course of the day, I have no idea what these people do because, when they're not seeing patients or doing procedures, but you're still getting a paycheck in the mail. And so there was a period, and I don't know if this is still in effect, there's a period for the WashU network, which incidentally I should point out that that's a very elite network. It's an elite. By that I mean it's really world-class reputation. Some of the top docs in the world are at WashU. That's the reputation of WashU. But there was a memo that went out earlier in the year, maybe it was around April or so, in which I think they reduced by 20% some of the salaries. But if you think about it, so you're a surgeon, you were getting, say, $500,000, $600,000 a year, maybe $800,000, $900,000 a year would probably be closer to it. And so you get a 20% reduction, and in return, you have nothing to do. So you're free, and you're getting this 20% reduction, $750,000 a year.
Not a bad trade-off.
No, I think they were fine with that. I imagine. Whereas if you're independent, there's no fat check coming from a big corporation that's going to pay you. And instead, if you don't do surgery, you have overhead. I mean, you have to pay for your surgery facility if you own one of those, and you have to pay for your staff, and there's no cushy corporate bonus or benefits that you enjoy as a corporate employee. And instead, I can see how, and that I would predict that those in that situation would, in larger numbers, be trying to see clients as much as they can and trying to get in to do procedures to the extent they needed to in the large facilities.
Right. I mean, that's what we've seen. And, it goes beyond the hardcore medical aspect of it, too. I spoke with a daughter of a patient of ours who was in the hospital last week with COVID. And she said, my mom's doctor has called me every morning after he does his rounds and sees her, just so he can update me and my family,
Wow.
because, of course, they couldn't go in and see her. And so, there are some benefits that are, I don't know how you would classify that, psychosocial or sociological or,
Mm-hmm.
you know,
Hmm.
emotional, but that go kind of beyond the cut and dried medical aspect of
Yeah, the
things.
interpersonal.
Yes,
Yeah.
that's a good word.
And there's all this promise about a vaccine, but I've heard a lot of people say they won't take this vaccine. They're afraid of it. And having said that, are you going to require your employees to take it to continue working? Are there any exceptions, like, say, maybe a religious reason?
We are not going to require our employees to take that. I try not to get too dug in on any of the conspiracy theories. I've gotten the memes with the COVID zombies and whatnot.
Yeah.
Um, but we will not require our people to get the vaccine, essentially because the methods that we've been taking all year have proven to be
Effective.
extremely effective.
And you don't need everybody to take it to get herd immunity. I mean,
Yeah.
I've heard different estimates, some as low as 50%. If they develop the antibodies, then you'll prevent any widespread epidemic. You can have some people get it, so it's not as if it goes away, assuming the others didn't get the vaccine, but that it doesn't become a wide epidemic because there's not the opportunity to spread it
Right, right.
when half the people who come in contact can't spread it.
Right. Right. No, I agree with that. And I also think that, our medical, getting back to the United States medical community, and I'm sure leaders in other countries in the medical field have done a tremendous job. I mean, back in March and April, if we had a patient who went in the hospital with a viral pneumonia that was not specified, it was kind of touch and go about whether they would, make
Yeah.
it out of the hospital.
Mhm.
And these days, if someone goes into the hospital and they have a positive COVID test, it's it's kind of expected that they're going
Yeah.
to make it out of the hospital. I'm not saying that everyone does, but we have come a really, really long way in terms of
Yeah,
treatments.
yeah. I mean, and remdesivir, the steroids, they found are hugely helpful with people who are seriously ill, and used to they thought that they should almost routinely use some sort of intubation, and then they found out no, that's a bad idea. That those people tended to fare worse than trying to breathe on their own.
Mhm.
So, yeah, we've learned so much about how to treat this.
In a short time, really.
Yeah, yeah. And there are new drugs coming on, apparently, that are going to be approved. And then, of course, with Trump, I think Walter Reed used a cocktail that it seems that if you take several of these elements, which I think his probably include remdesivir, steroid, and maybe one or two other things, but it seems that you really get pretty strong recovery rate.
Yeah.
Yeah, I mean, I just think it's been really an incredibly impressive response from the medical community.
Yeah,
And I also, I'm the first one to say, like, nobody really enjoys the lockdown, but this is also the first time we've done it. Um, and hopefully the last. But if it's not, I think it will be much better the next time we do it. I mean, I think that's why Asia has been so successful. This is not their first rodeo.
yeah, yeah. That's a very interesting topic we won't go into, in part because probably neither one of us is qualified, but me less than you. But it is a phenomenon that will be studied for years to come. How people who are in Southeast Asia generally have fared so well, and some have suggested that it's some sort of genetic component. But we know there were good policies in South Korea. They did testing, just almost universal testing early on. But that's not happened in Vietnam, and it's not happened in Cambodia and various countries in Southeast Asia that have had relatively low problems. And Australia has done very well. New Zealand. So it's weird how it's almost like a geographical segment of the globe. They seem to have even China. And some would say, well, it's because they're heavy-handed stormtroopers, took control, and they did. They did in Wuhan. But even since then, though, they've managed to stamp out ways that, to a degree of effectiveness that goes beyond explaining simply in terms of their strict police state efforts or policies. So it is interesting to me that some parts of the world seem to have done much better for reasons that aren't very clear in some cases. South Korea, the reason's clear, but it's not so clear in the rest of Asia why they seem to have fared so well.
What an amazing time to be an epidemiologist.
Yeah, no kidding.
Yeah. My daughter who's in medical school, I tell her, I said to her, that's a great field, and I don't think that she's going to act on my suggestion. And often turns out that in retrospect she shouldn't have. So I press my recommendations with caution. Anyway, Ann, you've been full of information. Time has flown. We've kind of talked about a topic that I know is one that probably occupies the thoughts of older people more than anything else, perhaps, during the last 10 months or so. And we hope that'll cease to be the case. But until that change of circumstances comes, it's better for them to have more information than less. I know you agree with that.
I do. I really appreciate being invited on to talk about this because, it's just a hard time for a lot of people. And I think talking about it makes it a little bit better.
I agree.
Yeah, it does. So Ann Laban, CEO of Premier Home Health, a lot of great information. Time has flown. This has been another episode of Elder Talk. Till next time, take care.
You've been listening to Elder Talk with TuckerAllen, providing intelligent answers for those thinking about their future, with Attorney-CPA Joe Cordell. Sponsored by TuckerAllen, your estate and elder law advisors. For more information, visit TuckerAllen.com. Listen again next Saturday for another edition of Elder Talk with TuckerAllen. The choice of a lawyer is an important decision and should not be based solely on advertisements.